My name is Jeri Conboy, and I'm here to talk with you about hospice care. And I have worked at Blessing for 28.6 years, to be precise, and all of that time I have spent in hospice care. Does hospice pay for medications? Yes, that's one of the services hospice provides. We pay for medications that are related to the individual's terminal prognosis. The most frequent kinds of medications that a patient will be having and that we will be paying for are pain medication, medications for restlessness or anxiety, medications to make sure somebody's bowels are working properly, because sometimes pain medications affect those. So whatever the medications are that somebody is needing that's related to the reason they're receiving hospice care, hospice pays for it. Does hospice require a DNR order? No, it does not. If you don't know what a DNR order is, it means do not resuscitate. So what that means is if a person's heart stops beating or they stop breathing, then they will not be resuscitated. Hospice does not require that. Many of our patients have a do not resuscitate order because they've spent the time talking with their family and their providers about how they want to approach the end stage of their life, but it's not required. Does hospice hasten death? That's another thing people think about when they think about hospice. Often we hear people say, oh, they're just going to give them morphine and other medications and that will hasten their death. Absolutely not. Hospice is all about improving quality of life so individuals can live each day to the fullest and live as long as possible. In fact, there is research to support that hospice actually prolongs life for many patients, and that's because of the excellent care they receive once they begin receiving hospice services. So hospice is not at all about hastening death. Does hospice provide physical therapy? Sometimes. It depends. So hospice develops a plan of care that's individualized to each patient, and what is included on that plan of care is what that patient needs to provide them comfort and to address any problematic symptoms they have. Sometimes physical therapy is helpful so that a patient maybe can transfer more safely from a chair to their bed to a wheelchair or whatever. Physical therapy designed at rehabilitating somebody probably wouldn't be part of hospice, but in some situations physical therapy is an important service that can be provided. Does hospice let you keep your doctor? Absolutely. It is the patient's decision who their attending physician is. In fact, when somebody gets admitted to hospice, they actually have to sign a document saying they chose their own attending physician. And along the way, if they make a change, then they have to sign another document saying that they chose to change their attending physician. So if your physician says, I can't be your physician if you become a patient of Blessing Hospice, that would be just a misunderstanding. Hospice patients get to keep their physician and continue to work with whoever they've worked with. Sometimes a patient's physician may ask the hospice medical director to become involved in their patient's care. And that's often because maybe the hospice medical director has more expertise in dealing with pain and symptom management, and the patient's attending physician would feel the patient would get better care that way. But that's between the patient and their own physician. Does hospice provide pain relief? Absolutely. That is one of the most important things that hospice does provide. Our services are centered around comfort, which is centered around pain and symptom management. If somebody is in pain, they can't enjoy the rest of their life. So that's one of the many things that we focus on early on in providing hospice care, is to determine what kind of, if a person is having pain, that's the first thing. And if so, what have they tried in the past, what's worked, what hasn't worked, so that we can work as a team with you and your doctor and our full team to make sure that we have relieved your pain the best we can. And last question is, does hospice provide food and fluids? And I think this question means, does hospice provide what we would call artificial food and fluid, and that would be through IVs. And again, that's a depends question. It depends on what the situation is. So if you keep in mind that the goal of hospice is to provide comfort care, then everything we do is focused on keeping a patient comfortable rather than reversing the course of an illness. So our body is a wonderful, mysterious machine that has its own way of basically getting us ready for our own death. And part of that is we're no longer hungry and we're no longer as thirsty as we were, and not eating the way we used to isn't painful. It's not starving somebody. It's not the same problem that it would be, for example, if I didn't get to eat 3 meals a day. So what we do in hospice is look at what the symptoms. So if somebody is feeling maybe their mouth is dry, so you think they might be dehydrated, rather than inserting an IV, which can be painful and cause its own set of problems, then we'll work with you on how to do great mouth care, how to give little sips, those kinds of things, and the same with food. So food and fluid by IV might happen in a specific situation, but it's not a routine intervention that hospice provides.